Good morning. This is Dr. Judy Saalinger of Lasting Recovery. We're in an intensive outpatient treatment program. We've got outpatient detoxification services to offer you, and we've got some terrific staff. We've got an addiction doctor who's been treating people with detoxification and withdrawal syndrome for over 40 years, Dr. Bruce Pevney. He's excellent, and he'll be able to help you to reduce the symptoms of your withdrawal syndrome with different ways, different methods that he has, and glad to help you and let you know what it is that you can do to get off of the pain medications and to begin to start living your life again. And I know that I've had many calls from people who said, I just feel like I want to die because I'm given all these, Vicodin and OxyContin, and now they're telling me I have to have more surgeries. And, that's one option, but what the doctors don't always tell you is that there's many other options for how you can treat yourself and how you can get well. And today I have with me Tamara Anderson, and Tamara is actually our Director of Admissions at Lasting Recovery, and I wanted to talk with Tamara today because Tamara has an outstanding experience about how she got through dealing with this opiate dependence and benzo dependence, and how she is able to begin living her life again. And one of the things at Lasting Recovery is that we've all suffered from some sort of pain and opiate dependence during our addiction, and everybody's certified, licensed professionals for many years, but we learned how to integrate our life. We learned how to treat ourselves in modalities that really weren't recommended by the doctors because, our medical community will really give you a prescription for a different medication in order to solve the problem. And what we found is that doesn't work. That doesn't get us into the solution. All it does is get us more dependent on the chemicals. And so, Tamara, are you still with us?
Yes.
Okay, great. I know that for myself, I had to learn to do mindfulness meditation. I learned how to do yoga. I changed my eating habits. I began stretching. I began doing affirmations. I did massage, aerobics, kind of water therapy, acupuncture, and music therapy. I've started listening to lots of Beethoven's music. That was very helpful for me. And I started listening to a lot of humorous tapes. Now, did you do any of those things, too, to help you to begin healing once you got through your detoxification? Or as you were going through it, I found that I had to begin doing that as I was detoxifying. How about for you?
Yeah, and a primary thing for me, too, because the year that this happened to me, this was 2000, using the opiate pain medications brought me back to alcohol.
Yes.
And so then I had double duty. And then there was the guilt because I had given up 6 years of recovery, or I felt like I had. And the answer for me not only was detoxing off of the medication and having to find alternatives to care for my chronic pain issues and separating my suffering, I needed to do some therapy to walk through my suffering.
Yes.
To walk through the issues I was masking eventually with the medication. I needed to return to my tools of recovery that I had used successfully with alcohol.
Uh-huh.
I had to pick those back up again because, of course, I walked away and put all those down.
Yes, but those work.
They work.
Yes,
for me, that meant going back to AA, where I had gotten sober, getting some new friends because I had moved to a new area, and applying those steps towards, now I was applying them towards opiate pain meds, not just self-medicating with alcohol. And for me, I was a young mom, well, not so young at that time, and that's really what it was. And my experience with alcohol and with pain medications was very private. It was all just me and that substance. I did not have a partying lifestyle. I had, kids at home. I was a primary caretaker for them. I was not working, and it was a really heavy guilt factor, and I really needed to work that through. So I got a sponsor through AA that also understood chronic pain, and it took some asking, but I needed to find someone who really understood the duality that I was dealing with.
Yes.
Because pain was real,
Yes.
Of course, and it was going to be a long haul. There were 4 years of recovery from that injury before I even had the first back surgery. So it was a lot of changing my lifestyle to where I had to put some of my perfectionism and do it all myself aside.
Oh,
ask for help.
That was so.
You
that
know
moves
that I
you
have
out
that
of,
characteristic.
yeah.
You can relate to.
Yes.
And I had to ask for help. I had to learn how to receive it and be blessed by letting others help me. And in that, let them help.
Well, and that's one of the pieces I think, about the addiction, whether it be to pain or to alcohol, is that we feel so alone. It just becomes so all-consuming that you're really your body's just thinking about the next pill or the pain or the listening to your body looking for triggers in order to use.
And getting clean or sober off of a substance, any substance, is a very humbling experience.
Yes.
For me, getting off of the pain meds was even more humbling. There were physical consequences that I hadn't experienced before. I ended up in, having tests because my intestines were bleeding. Because I had taken so much of these medications for so long, and they were all by prescription.
Yes.
So somehow I wasn't as bad as the person who was buying them on the street. There was all kinds of mind games going on that I was justifying my actions, and my doctor who was doing the prescribing really didn't know about addiction.
Yes. And we're here talking with Tamara Anderson. We're talking about the problem of having a chronic pain syndrome and becoming chemically dependent, and what it is that a person can do to get off of that. And Tamara, as you shared a little bit about the things that you were doing, and you said you went back and you began using the tools that you had used before. And so it's like bringing up those, the memories and those experiences. And like you say, getting away from this isolation and breaking through that shame and guilt, asking other people for help. That was a big step, wasn't it?
It was. That was probably the hardest one.
Yes.
And things got easier after that because it allowed me to have permission to have a little bit more of my voice. And to know that it was going to be well received. But it was a big step of faith to say, in a meeting or on the side from a meeting and with one person I was comfortable with, to say, I'm really having a hard time.
Yes.
And I don't know what to do.
That recognizing that we feel powerless and helpless. It's like, what is it that we can do? What are the answers? Is there an answer for me? And so much of our thinking has been that there are no answers. Yeah, and there are. There are answers.
And sometimes they're a little different for everyone.
Okay.
You've got to find what works for you and do that.
Okay.
For me, it was picking up those tools again in 12-step recovery. In addition to changing parts of my lifestyle, I needed to drop some weight, which helped my back.
Okay.
I did. I lost 20 pounds.
So Tamara, it sounds like you took some actions that were really, really helpful. I appreciate that, and we're going to get back with you again. I have Debbie on the phone from San Diego, and Debbie, are you there?
Yes, I am.
Hi, Debbie. This is Judy Saalinger, and you're on KCEO 1000. How can we help today? What's going on?
I have a sister that I visited this weekend. She is a over-the-counter prescription user. I'm not quite sure what she's using. It's been like 20 years, but it's gotten worse because she's having delusions of she's being followed.
Oh, gosh.
And
okay.
It's gotten really bad, and even her actions are, they're radical. They just don't make sense. And when we try to reason with her, she just won't hear any of it, and we don't know what to do.
Okay. It sounds like your family would really benefit from an intervention with her. And that is something that can really be helpful because she's stuck. She's stuck in the addiction, and it begins to affect the brain in many ways, which can be a little bit destructive. And so it sounds like she needs some help right away. If you call our offices at 858-453-4315.
Mm-hmm.
And, we can connect you up with an interventionist that would be able to work with you and your family to be able to try to reach her and get her some help. These people are professionals, and they know what to do in order to be able to help you and to help her.
Okay.
Okay.
Okay, thank you.
Sure, and good luck to you, Debbie. I know that this is a big problem, and there's so many times when, family members feel so helpless, they don't know what to do, and, there's such a level of suffering that you go through,
Yeah.
seeing your family members suffer, and you can't reach them, you can't talk to them, they can't hear you, because of the denial and the distortion that's going on in their altered reality.
Yes, and you're right, we don't understand it, and we don't know how to help her.
Yes, and one of the things that we find with our family therapy, we have a lot of people who come in, patients come in, and then the family members come in, and everybody's trying to understand it. So the family member's trying to understand what goes on, and the person who's addicted, they don't get it either. They don't understand that their brain has been hijacked by these very, very powerful chemicals, and it undermines their relationship with theirself and their family, and it's a terrible thing. So the education and knowledge that you'll get if you can do the intervention and see if you can get her into treatment, you'll be so pleased with the outcome as to how it'll help you and your family and help her as well.
Yes, I'll definitely follow through, and I'll call your number, and I'm just gonna continue to proceed on and pray that she will be willing, and that the family member will meet together and we'll do this.
Yes, and this happens all the time. I know we had an intervention take place this weekend for this very similar kind of problem. Somebody was on opiates, and it's a help. It really works.
Yes, I'm excited to see a professional that knows exactly what she's going through and what to do to help her, because my younger sister, and I don't want to bury her. That's for sure.
Yes, and that's the fear. That's the fear, and it can be a reality. That's the very, very scary part about this, is that it becomes reality. And so call the office again, 858-453-4315, and let's help you and your family get into the solution.
Okay.
Okay, Debbie. Thanks a lot.
Thank
Bye-bye.
you.
Okay.
Bye-bye.
Thank you. We're here. My name is Dr. Judy Saalinger, and we're here at Lasting Recovery, and where we bring freedom and hope to you and your families who are suffering from alcohol and drug dependence. Today, we've been talking about chronic pain syndrome and opiate dependence, and how is it that you know that you're addicted? What can you do about it? We had Tamra talk a little bit about some of the things that she did. She had developed an opiate dependence from an injury, and she had some previous experience with a support group that she went back to and picked up some of her skills. And I know for myself, what I didn't have any of that, but I had to start learning when I was getting off of my pain medication. I had to learn, about mindfulness. I had to, as I always said, to develop an internal locus of control. So in other words, my control panel that ran my body and my mind was located in a little brown pill bottle. And I had to take that and all the tools and develop those things inside. I had to think about, what was I thinking? How was I feeling? How did my thoughts affect my feelings? What was my hope? What did, if I could imagine myself being pain-free and being off of these medications, what would my life be like? When initially it was like, oh, it'll never work, nothing will happen, life sucks, this is the way it's going to be forever. And I want to tell you folks, that doesn't have to be true. You just have to work at starting to believe that you can overcome this. And, it's a struggle for families like this young girl, Debbie, said, she doesn't want to bury her sister. And I can't tell you how many hours a day I spend talking to people in our offices where they have the same fears, and this does happen. They're not talking about something imaginary. This addiction is a severe, out-of-control epidemic that is killing people every day. There are poisonings increasing. That was 60% or so increase in poisonings as a result of the dependence on prescription drugs. because what's happened is that, with all the advertising on the radio, it's like, have this drug, that drug. People are directing their physicians into what kind of drugs that they want. Little kids are, young teenagers are raiding their parents' medicine cabinets and starting to take, benzodiazepines that are in the cupboard, and opiate pain medications. They have parties where everybody shares their pills. They don't know what they're taking, and it's truly a mess. So anyway, if you have a problem that's going on with you or your family member, give us a call. You can call our office at 858-453-4315. I'm Dr. Judy Saalinger with Lasting Recovery, and Lasting Recovery is an intensive outpatient, nationally accredited program. We take many insurance plans, and we have an outpatient detoxification. We have Dr. Bruce Pevney, who's an addiction specialist, and he can use Suboxone to titrate people off of use the Suboxone for them to begin sort of titrating off of the medication and off of the symptoms of the opiate withdrawal. And he's excellent. He's been doing this for over 40 years with folks, and we have a great deal of faith in his ability to help you to get started. And then as our staff can help you to learn how to live pain-free. We also have something called Active Recovery, and Active Recovery is a program that teaches wellness training to our members in our intensive outpatient program. And, we have yoga, we have acupuncture, we've got music therapy, art therapy, nutrition, all of the elements that you'll need in order to feel strong again. And this is something that can happen. It doesn't happen overnight, but it does happen one day at a time. So today, we've been talking about chronic pain and opiate dependence, and they go together oftentimes, and the fear of pain is greater than the pain itself. And what we find is that, pain medication, if you're taking it for over 30 days, you could be in trouble. If you're borrowing from friends or purchasing from drug dealers, you could be in trouble. If you have a past history of drug addiction, or you're taking more than the recommended amount of addiction, or lying or hiding about it, give us a call at 858-453-4315. We've also been talking about how it affects the family, and you could hear from Debbie, our caller, that she and her sister are worried very much about her other sister who has a substance abuse problem. And the thing is that if problems aren't solved in the early time, when someone begins to get addicted, it just gets much more severe, lots more brain damage and other things. So today, again, I'm with you. This is Dr. Judy Saalinger for Lasting Recovery. Have a great week.